Hello, this is Dr. Do again. This video is an alphabetic list of problem on letter F. Today I'm going to talk about the fever. It's so common, you probably think it's not worth to talk, but I just probably put everything together and to remind a different age group what are the major causes, what are the serious problems. So before I talk about further on that part, I just briefly mention or remind you probably know what kind of situation associated with the fever needed to visit the emergency room. You probably know it. First of all, it's high fever, which was not brought down by the medications. I'm sure when we had fever, the first thing respond to in our mind is to take some fever medication, either Tylenol, Motrin, or aspirin, whatever the variety, whatever you're available. But worth to mention is aspirin, and probably is not good for the children, especially infant or young children, because it's associated with a disease called Reye's disease. So that's probably you already know it. Back to the situation that the fever need to visit emergency. So high fever which cannot be brought down by the medication, or the fever associated with other really serious problems, such as I mentioned before, projectile vomiting, which means that's the irritation to the meninges, which means probably the meningitis is very likely, especially if you feel the rigidity of the natural area. So that's the emergency situation you need to. Or fever associated with other symptoms like seizure, or usually it's not common, but it could happen, especially young children. The medication cannot bring down, and then or the medication was not given regularly. So these are the situation or the fever associated with altered mental status. So these are the emergency situation that really associated with the fever, regardless of the cause. If any of this kind of problem associated with fever, need to go to the emergency room. Is there any fever that you can manage at home? You probably know it, and you probably already did it. Of course, there are a variety of causes of fever can be managed at home. Just the common cold, or during the season, or with or without other symptoms, as long as the medication works. The important information here I'd like to share with you is to remind you, follow the schedule. For example, use Tylenol every 4 hours, and do not take more than 6 doses for 24 hours. So this is one thing. Or if there are a lot of situations, especially young children, use one medication, Tylenol is not enough, then you can add another one, but the schedule, add another medication of fever medication, you need to consult your nurse or your physician to make sure intermittently, which means, like, for example, a Tylenol give at 9, and then 11 o'clock, if the temperature is still high, then by 11 o'clock give a dose of Motrin, and then follow the other dose of Tylenol at 3 o'clock, and then the Motrin can be lasted from 6 to 8 hours, like a longer time. So these are the situation that fever associated with fever you can manage at home. However, if the temperature cannot brought down, call your physician or go to emergency room. There must be something, even though they probably just give you an icy bath, but still that can really lower the temperature. So having said that, in between of this any categories, like persistent low-grade fever, then what are the causes? You need to see your physician. So usually fever, what is the fever? What is the fever? Fever is the body response to maintain the homeostasis, which is good. Actually, it's good response. Our body has the thalamus to associate with this temperature regulation. So any of the pyogenic agents which can generate the response to elevate the temperature. So what are the causes? Like I said, what kind of the fever, like low-grade persistent fever, what are the causes for this group? This usually older people or younger people. Tumor is the one. Actually, if it is the case, pretty much is malignant tumor caused the long, persistent, low-grade fever. That's one of the possibility. Or some bacterial infection can do not associate with high fever. We know the bacteria causes one of the most notorious pyogenic pathogens cause the high fever. But some of the bacteria cause low-grade fever. One of the examples, TB, for example, just have the persistent low-grade fever, and then with the losing weight, coughing, and special facial color because of hypoxia. So these are, regardless the cause, if you have persistent low-grade fever, then you need to call your physician to get it checked. And the other situation I like to mention, especially in older people, dehydration. Dehydration is another cause, can cause low-grade fever without notice, especially in older people. Talk about this, always talk about the older people, because the functional level, and also because of the thought, the mindset, thinking I've been healthy, I'm good, very depressed, I'm not worthy to live, or whatever it is. So these are kind of situations. So a lot of time, elderly people have low-grade persistent fever. Could be the dehydration, or could be the urine tract infection. So these are the very common cause, and could be very minor if managed in a time fashion, or under the guidance from the professional or the physicians or your nurse, or could be very serious. For example, I said if the elderly people continuously dehydrate, or continuously urine tract infection without diagnosed, without treated, then the situation will be getting worse and will be tough to treat. Actually, there are some cases. So this is about the fever. There's another special situation of the fever without known origin, fever of unknown origins. This is really, I think it's a concept used in the medical community. So there's a definition, like do the whole workout for the 1 week, but still couldn't identify the cause of this, and still just monitor or symptomatic management, or there must be, or autoimmune causes. So basically, regardless at the patient level, if you have persistent fever, high or low, you need to, which was not brought down by the medication, then you need to see your physician, even though it's not emergency, but you need to talk to your physician. So this is the video for today. Probably it's very common, you already know it. I just put it here to remind you if you know it, and hope it helps. Thank you for watching. I will see you next time.